My name's Dolores.
Hayley.
Oh, nice to meet you. I'm Irene. I'm one of the nurses. I'm just a bit concerned about Francis because I put that bag of blood up about maybe 15 minutes ago and he was absolutely fine, and now it's just been acting a bit weird. So I was wondering, do you mind just taking a look at him? Is that okay?
Yeah, absolutely.
Just a bit concerned.
Yeah.
Should we stop the blood first while we do our assessment? Yeah, let's do that.
Right,
Yeah.
I can do that.
So
Yeah.
Francis.
Francis, yeah.
Hello, Francis.
Hi.
Hello, my name's Hayley. I'm one of the doctors. I'm just going to examine you a little bit because I understand you're feeling a little bit unwell.
I don't know what's happened. I was fine.
Okay.
I don't feel well.
Is it just generally unwell? Is there anything specific
I
going
don't
on?
know. I don't know. I just don't feel well.
Okay, right. Am I okay to start examining you and then we can work out what's happening?
I don't know.
Okay.
I just don't feel well, doctor.
Okay. Could we get a repeat set of options and go along?
Yeah, of course.
Well,
Yeah.
So, am I
I
okay
just
to...
feel I can't breathe.
You can't breathe? Okay.
No,
Let's just take your
I
oxygen
just don't feel.
saturation.
I feel a bit.
Start with that.
Okay, so A is maintaining zone area. That's good.
Sorry
I
about
don't know. What's happening? Am I dying?
No, you're just feeling a little bit unwell
I
at the
feel
moment.
like that.
It's okay. Well, we'll do an examination and we'll see where you are, okay? I'm just going to start by listening to your chest. Just take some deep breaths in and out for me.
No, it's not working. Oh, 38.6.
Okay. We'll just disconnect this blood actually, shall we?
Yeah,
I'll just do that.
Yeah.
What's wrong?
Francis, could you take some deep breaths in and out for me?
I can't breathe. I said to you, I can't breathe.
Okay. Oh, you already disconnected. All right.
Yeah.
I can't breathe.
Alright. I'm just going to order a portable check. The previous one. Yeah, fine.
Says he reduced it eventually.
I'm going to order a chest X-ray.
Yeah, do you want to
Yeah.
order it by phone?
Okay,
or-
fine.
Yeah?
Fine.
If you just press
Alright.
it.
Francis, so we've got a respiratory rate of
Can I just get rid of this or?
saturation.
We'll just keep it here for now. Yeah.
Right, okay.
What was the respiratory? Oh, sorry, respiratory rate 2094. Okay. I'm just going to have a quick feel of your pulse, okay?
Would you like a blood sugar as well? Yes, please. Yeah.
Hi, my name's
Regular.
I was a bishop. I've
I'm
got
just
a
gonna
patient
have
I'd like
a
to order a portable chest X-ray for.
Fingers, okay.
Yeah.
Ouch.
Name's Francis
Sorry.
Richardson.
Sorry, we're just going to
Date
take
of
your blood
birth
sugar just
is
to check to see where you are.
6.2 would be
Today.
I was feeling well. I don't know what's happened.
I know, so I think we've started some blood. You had a
We
blood
are in the sector of Bishop Auckland.
transfusion running, and I think we just stopped it because obviously you're feeling a little bit unwell, so I'm just trying to work out what's going on here.
I don't like it.
I know, I'm sorry. Could we get an ECG as well, please? Pardon? An ECG, please?
Yes, of course.
I'm just going to listen to your heart sound,
Refill,
okay?
doctor.
Your heart sounds normal. Francis,
Can I have the ECG machine, please?
torch.
Okay. What are you looking for, sorry?
Just a few, a pen torch. Yes, please.
Oh,
This one's
it's
just
just
there. There you go. Francis, can I ask you to open your eyes for me? Just for a second.
I don't feel well.
I know.
I can't open them. I don't feel well.
Okay.
I just want to sleep.
Okay.
I don't feel well. That's not thing.
So at the moment, the nurses asked us to come and see you just because you were feeling a little bit unwell because of the blood. So at the moment, we're just trying to work out what's happening. Okay. Can I just have a check and see what's happening with the like, see if you've got any other injuries or anything like that? Can I have a quick feel of your tummy? Thank you. Any pain anywhere here?
No,
No.
no.
Okay.
I don't feel well. I don't feel well here.
No other injuries noted.
Do you think he's
So I think So maintaining his airway, saturating 92 at the moment. Can we put a little bit of oxygen on, please?
Yes, of course. What would you like? Nasal cannula? No,
Yeah, just a nasal cannula, please.
Feel
been to
weak.
take my patient's bloods this morning.
So maintaining his airway.
We've got. I'll just double
Will you
check.
just check?
Yeah.
Thank you.
Got that then.
I feel
Does
well.
he sound overloaded?
He's got reduced airway level.
Fine. Okay. I've ordered the chest X-ray. So, I check the guidelines, but normally it's like the blood is kind of scrambled or something, isn't it?
How are you feeling now,
I
Francis?
don't feel well.
Let's have a little look.
I don't feel well.
I'm sorry about that.
What's happening here?
So Francis, at the moment,
Yeah.
we've done our assessment of you, and what we've done, we've asked for a chest X-ray to be done. Okay, just to see.
But I thought I was told I just need some blood.
Yes, but I think obviously you've become a little bit more unwell after the blood, so we don't want to keep going with that and make you feel even worse. Does that make sense?
Do you know if I have
But the doctor said to me in the morning,
Sure.
I need blood, that's why I'm feeling weak. But I'm feeling worse now.
Yeah, so that's why we've kind of stopped the transfusion at the moment, okay? And we want to see if there's anything else going on, because your oxygen's a little bit lower than what we would expect it to be.
I don't feel well.
Yeah. I know. We're going to try and make you feel better though, okay?
I don't feel well.
Okay. So,
Excuse me, could I speak to one of you, please?
of course,
Just wait. Just a bit. I think, I don't know, I've got a feeling that, do you know the colleague who came in?
Mhm.
I've got a feeling that I might have taken her patient's bloods because their names are very similar. So he's Francis Richards. And I think he's Frank Richards. And I think I got mixed them up. And I've got the same hair and everything, so I think I got
Okay. Okay, don't worry. Right, we'll sort this out. So, it's
it's never happened to me before.
fine. Don't worry.
No, I am worried because I might lose my job. I mean,
Well-
I know that it's happened before. And it wasn't it wasn't a,
Well, my gosh, these things don't happen in isolation, do they? So what we need to focus on first is just figuring out what we need to do immediately. So I'm sure there's a trust guideline somewhere for this, just in case there's anything we need to start straight away.
Yeah. Is there like an overload line or anything?
Well, it might be like an incorrect match. Do you know what I mean? Anyway,
it's never happened to me.
it's fine.
I'm so sorry, please don't be upset with me.
Of course. So he's definitely having some kind of reaction. So we've stopped the transfusion.
Is he just, do you think that's definitely, is it maybe they've got the same group or blood group or?
Well, we don't know. So that's so as we find out, we can
Because if they've got the
assess.
same blood group, then, it's, maybe it's not up behind, do you know what I mean?
So
Oh,
let's put up first of all. Let's put up some fluids, some normal saline.
Sorry.
And does he have a catheter in?
No, I don't know.
We'll pop a catheter in so we can monitor urine output. Try and keep the urine output up. So let's do that first then, shall we?
What's happening here?
Hello.
What's
We're just
happening?
figuring out the plan at the moment, okay?
What's wrong?
Alright.
So
honestly just watch.
we're not
What's
really sure
wrong?
what's going on at the moment. We think
okay.
there might be some extra fluid on your
It's
chest,
gonna be alright.
but that's why
Why?
we've ordered the chest X-ray.
11 was made by one
So that can sometimes
There's
be.
always
Why will I get fluid? I was only feeling unwell. I was fine. I had a bleeding and they said to give me blood.
Yeah.
Why am I getting
It's okay.
Yeah.
chest fluid?
So sometimes when people have had blood
figured out what's happened very
transfusions,
quickly.
it's
You
quite
escalated it straight away. You knew
with
something was
known
wrong.
side effect is sometimes it can cause fluid
Why is she
You're not
crying?
gonna get the sack. You're not going to get the sack. It's
I'm
very
not
likely
entirely sure. I think we'll go and
We'll make
I'll
a
go and have a
report
conversation with them and we'll see.
Why
what
is she crying?
to do.
we can explain everything.
I'll go
Okay.
and have a conversation with them in a second. But how are you feeling at the moment?
Get a cup of tea or something. And
Do you feel that the oxygen's helping at all?
Yeah, but why? What's happening here? I'm worried. Why is there so many people coming in?
We've basically just had
What's happening with me?
Francis, I want you to focus on what's happening with you rather than what's happening over there, okay?
What's happening here?
So,
Why am I unwell? I was just getting blood. Where's my blood?
so like I said
Where's my blood?
before, Francis, and like I said before,
Where's my blood?
But
when patients
what I think
sometimes
is
have, when they
important
have a
now
blood
is
transfusion like you were
we'll
having,
try,
Yeah.
we'll do what we need
sometimes
to do
it can
here.
cause a
If
fluid
you're willing to
build-up
help
on
me,
your
Irene, do you want
Yeah.
to
and
just
we
pop
think
out
that
and
potentially
get
this might have happened to you,
grab a
but
break
we've ordered
for
a chest x-ray to
15
kind of
minutes and we'll
check
come in and
for
have a
you.
chat a bit later.
And obviously with that being said, we wanted to stop the transfusion for now.
Yeah, but where's my blood?
I'll speak to the system, we've taken it away for the moment.
Where's my blood?
We'll get you alright.
We've stopped that transfusion at the moment, Francis.
Get yourself
Yeah. Where's
Just
she?
we don't want
Why
you
is she
to
crying?
So
Why is she crying?
We can communicate about this in a second, but I want you to
Why is she
check
crying?
Right, we'll come back in
Am I going to die?
minutes.
No,
Where's she,
Francis.
what's happening here?
We've got a good management plan going, okay?
No, why are you not telling me what's happening here?
30 minutes.
Yeah.
And
So
then
at
you get
the moment
half
we've
an
stopped
hour
the transfusion
and
Yeah,
so
why?
you're-
Why?
because
Then
we're
there'll be some
worried
blood
that
back.
you were going to feel a little bit more unwell with the blood,
No.
okay?
I don't feel well.
Fine.
What's happening here?
Fine.
I know. So we've stopped the transfusion at the
I
moment.
don't know.
What's the patient's name, sorry?
Francis.
Francis, okay. Francis, I'm just connecting you to a
Alright,
drip.
who are you?
My name's Francis too, okay? I'm one of the nurses.
Why?
Alright? I'm just putting you on a drip, okay?
Why?
Well, the doctor's asked me to, because we think you might be having a...
Where's my nurse gone? She was there. What did she give me? I don't feel well when she gave me something.
No.
No, I don't feel well. What she gave me?
Has the doctor explained what we think's happening?
No, well, she said she just stopped it.
I'll go and have a conversation with the doctor and see what's happened, and then I can update you appropriately, okay? But for now, just try and focus on how you're feeling, okay? We're giving you some
Supposed
fluids.
to be having a blood transfusion today because he came in with
Okay.
a suspected
Okay,
GI.
so they think there's an issue with the blood that they've given you.
What do you mean by issue?
We're just getting a bit more information. I'll let the doctors explain it to you. Okay, I'm going to give you some fluids for now.
Am I alright? Am I gonna die?
We're just checking you over for now, okay? I'll let the doctors have a chat with you.
Okay.
Because of the nurse raised some concerns about how the sample was taken. And I put up a guideline and we've stopped the transfusion, given some fluids, and we monitor urine output and stop all of the bloods. And is there anything else we need to do straight away?
Just popping a catheter in, okay? To just check your water works, okay?
Yeah.
Okay.
Yeah.
I don't feel work.
Yes.
I don't feel well. I don't feel well. I don't feel good.
Francis, what's happening?
I don't feel good.
Yeah, we put up a normal staging.
I don't feel
We've got
good.
fluids running at the moment.
I'll just grab the ECG machine, give me
I
one
don't
sec.
feel well.
Francis,
Lovely, thank you so much.
I don't feel well.
I'm just supposed to touch base for a second. Yeah.